Welcome to Nursing Webinar Series. Myself Shanti, and today's topic for discussion is on intravascular lithotripsy. And for more discussion and learning, today's expert panelist is none other Dr. Jagadesh Madireddi Garu, who is our senior consultant and interventional cardiologist from Yashoda Hospitals. I welcome you, sir, and we are very privileged to have you with us today. Yes. And let me also welcome Miss Anusha, who is our nurse manager from ICCU. I welcome you, Anusha.
Thank you, ma'am. I'm so grateful to have this opportunity, ma'am. So let us know about what is IVL.
Yes, so we will have further discussion. Now, first, just go back to the previous slide. The first insight we would like to understand from sir, is IVL a new treatment modality? And as well, we would like to understand that, are there any risk of calcium deposits reoccurring after this procedure? Yes, your view about this.
Yeah, hi, good evening, everyone. It's my pleasure to join you all for this week's session of our ongoing nursing webinar series. I think I should thank our Shanti for initiating and continuing this webinar. I think I've been regularly watching these webinars in Facebook. I always get an update about webinar, and I have followed a lot of those. And I think today it is my opportunity to have been here with you, and it's my pleasure. So this platform has been a very wonderful initiative to foster learning, and it's a collaboration and support from all our nursing teams. And I'm very much honored to be here in front of you. Each week, you are bringing a very interesting topic before us, so that these are the real life scenarios, and being updated about all these latest equipments is very much essential to improve our quality care. And since the nursing staff are the main pillars of our success, so training them in this latest modality is definitely an essential part of our learning. And I want to thank you for taking this initiative and continuing, and all the best. And Anusha, I think welcome. So you have put a very interesting question towards me.
Go to the previous slide, Anusha. Expert.
Yeah.
So
let us know about learn.
No. Just go to just a minute. Go to the previous slide. Yes.
Yeah. So you have asked me a very interesting question about the is IVL the latest modality, and does calcium recur after doing an IVL?
Yes.
So these are two questions are very commonly asked from all our patients. So definitely IVL is a latest equipment. In fact, IVL has been adopted from lithotripsy, which is a urological procedure which is regularly done to break renal stones. And cardiologists have implemented with technology this IVL into our routine clinical practice, because calcium is a big villain to a cardiologist. See, I have also had a lot of publications and presentations mainly on calcium in coronary artery, and there is one article which I have published recently where I am mentioning calcium, the big villain. So previously, calcium used to be a real villain to any cardiologist, because it's a nightmare to see calcium during a coronary angiogram and to intervene in patients with calcified coronary arteries. Mainly, the procedural complications go up, and the long-term treatment options are very limited, and the long-term prognosis of the patients is not that great. So with the introduction of a lot of equipments, and one among the latest equipment in that armamentarium is IVL. It is definitely a latest equipment that has come into practice, like the iPhone 16. And every cardiologist is excited to use this modality. And I should say this, that Yashoda Hospital is one among the very few hospitals in the country who has implemented IVL into clinical practice. And in fact, we are the pioneers of IVL in South India as well as Pan India. So definitely, this is a new modality for everyone, but not for cardiologists in Yashoda, because we are the ones who launched it. But even now, today, different cardiologists from several states look this as a very new equipment. But for a cardiologist sitting at Yashoda, it is like a one-year-old equipment, because we always get the latest equipments into our practice. So we feel IVL has been there for a year. But for people who are into the recent cardiology practice, they are very much fascinated to use or to see IVL. So this is the latest modality. And people do ask us, sir, if you do IVL and break the calcium with a balloon, will the calcium recur? The answer is yes. So we are just breaking the calcium that's already deposited, but then calcium reoccurs. So to prevent that, we have a lot of medications like statins, HTMI. There are several injections, and recently another injection has come, like the inclisiran, into the market. These reduce the recurrence of calcium formation in the coronary arteries.
Yes.
So I think on to you, Anusha.
Yes.
Yes, sir.
So on further going ahead, I think, yeah, kudos to all the cardiologists at Yashoda and all our entire team for this beautiful concept of new modality. And I was getting to hear from Anusha and you, yeah, as you have provided the step guidance while preparing the PPT and all. I think we'll learn further more. Yes, Anusha, over to you.
Yeah, we will learn about what is IVL. IVL stands for Intravascular Lithotripsy. It is a minimally invasive cardiac procedure to treat calcified coronary arteries. It uses sound waves to break up calcium deposits and making it easier to expand the stent.
So, sir, here we would like to understand what is this. Just go back, Anusha. Yes, what is this machine about? I mean, is this a tool, and like it uses sound waves,
Yeah.
and there is again one more line. It becomes easier to expand this stent. We may
Yeah.
not understand these lines,
Yeah.
so we are here to understand from your end. Yes.
Yeah.
Over to
True.
you.
Once the angiogram is done, during angiogram, we'll be able to see the calcified chunks in the coronary artery. And if the calcium is too much heavy, then we use one of the imaging modality like IVS and OCT. And based on this imaging modality, we suggest intravascular lithotripsy to our patients. As we stand today, I think close to 10% of all our angiograms have we have to use one or the other modality, because at Yashoda we get lot of cases from across the state and across the country where the cardiologist was not able to do intervention. So we get lot of referral cases, and these referral cases are always challenging. So we get to see a lot of calcified coronary arteries, and especially IVL is a very important modality where we can debulk the calcium. So once we have to see whether this calcium is very critical, whether it allows the passage of the balloon. Normally, in the routine cases, if the calcium is just mild, we will use a balloon to inflate and break the calcium. But if the calcium is severe, our routine balloon may not open up. Either patient can have a perforation or a dissection during balloon angioplasty, or the balloon may blast within the coronary artery. So to overcome this, we are using an intravascular lithotripsy balloon where we take this IVL balloon across the calcified coronary artery. Okay, if there is a calcium chunk within the coronary artery, I take the balloon across the coronary artery and then inflate the balloon. Inflate the balloon to a very low atmospheres and then initiate the process of IVL, where sonic waves will be emitted at 1 second, 10 seconds, 1 second per second. Okay, a sonic wave will be emitted every second, and 10 seconds, 10 pulses will be emitted over 10 seconds interval. And after that, we again, so with this sonic waves, the calcium breaks, and then we inflate the balloon to see how the calcium is breaked. So normally this IVL catheter can deliver, there are two types of catheters, C1 and C2. C1 delivers around 80 pulses and C2 catheter delivers 120 pulses. So we can place the balloon across the calcified coronary artery, inflate it,
Yes.
deliver 10 pulses, then deflate it, then again put it in another place, again inflate, again 10 pulses. So in this way, we can deliver close to 120 pulses. So a single balloon can be used for left, right, and for multiple lesions.
Okay, and Anusha, if we can just go to what is calcification, then I think we have dealt all this. And sir, is CAG is sufficient enough? Like a patient you advise first to CAG, and then after this the patient should proceed with IVL, sir?
Yeah, true. Angiogram itself may not be sufficient all the time, because angiogram is the first modality of choice before deciding IVL. So once we do an angiogram, this is a whistleblower. So if we see calcium in the angiogram, then we suggest another modality like imaging, like IVS or OCT. And based on IVS and OCT, we decide on IVL. If we find deep chunk of calcium or a calcium nodule, a routine coronary angioplasty balloon will not be able to expand this calcium, break the calcium. So I'll suggest IVL based on the imaging modality. So the first whistleblower will be a regular coronary angiogram, and subsequently I use an imaging modality to use the ideal modality of choice. Like we have not only IVL, we also have rotablator, we have orbital atherectomy, we have a cutting balloon, we have a scoring balloon. So IVS and OCT imaging, once done, can depict us which is an ideal modality for a particular patient. Based on that, we take it forward.
So, sir, here, like there might be a question, or maybe this everybody wish to understand who would require a IVL, like as you said about the modalities, imaging modalities, etc. So,
Yeah.
should we stick on this standard scoring pattern where more than 100 to 399 moderate calcium deposit, or more than 400? You see the patient's report and then you plan for IVL. Is that so, sir?
Yeah, oh, very interesting question. See, when we see a CT calcium score report, the CT calcium score is the overall calcium in entire coronary tree. So
Yes.
just by looking at CT calcium score, I cannot assess the need for IVL or debulking, because some patients will have calcium score of 1000, but the calcium is uniformly deposited, distributed across the coronary artery. This calcium is not a problem. But in some patients, this calcium is deposited only at one particular point in the vessel. We call this as a calcium nodule, where the calcium chunk is deposited as a mold in one particular place. This is a case where we have to use IVL, especially CT calcium scoring. Having it in hand before doing an angiogram is definitely helpful, because if I see a huge calcium score, then I might also prepare the patient that he might require one calcium debulking technique.
Yes. Go back to your previous slide, Anusha. Let us talk about, sir, I think these calciums are just seen like this in imaging. Are these the, plaque of calciums?
Yeah. So whenever cardiologist says calcium, calcium can be deposited anywhere in the heart. It can be
Yes.
deposited in the heart blood vessels. It can be deposited in the heart valves, or
Valves.
it can
Other
rarely
structures.
be deposited in the heart muscle also. But mainly the calcium that we are talking is calcium that is deposited in the heart blood vessels, and calcium that is deposited in the heart valves. So IVL is an ideal modality of choice when we see calcium deposits within the heart blood vessels. Okay, but then there is certain research data which is telling us that calcium deposits that occur on the valves also are available for breakage with IVL. In fact, we are the Yashoda Hospitals are the earliest hospital to use. I think hardly 2 or 3 hospitals have used IVL in valves, and I am proud to
Valves.
say that the Yashoda Hospital is the one hospital which started using IVL even for the valves. IVL is known to be used for vessels, but we are also showing its benefit in valves.
Yes. And regarding going forward, what is the average time required for this procedure?
Yeah. So average time depends basically on how many number of calcium deposits I want to break.
Yes.
Say,
Yeah.
as I was telling you, we have 2 different types of catheters. One is C1 catheter, which delivers 80 pulses, and C2 catheter, which delivers 120 pulses. Say, if there is only a calcium nodule at one particular point, and I just want to give 2 to 3 pulses, then I will give just 20-30 second pulses, and I think it will be done within half an hour. But if there is a huge calcium across LED, RCA, then the procedure time would go. But ideally, I would put it as around half an hour to 1 hour.
So based on the deposition of calcium in the heart structures, you decide your catheter, which is 80 or 120, and then that's how
True.
the breaking process starts
Perfect.
during this
Yes.
procedure.
Yes.
Yeah. Over to you, Anusha.
Yeah, there is few investigations required for IVL. That is 2D echo and ECG, and we need to send pre-angio panel. In that CBP, RFP, and creatinine we need to monitor, and electrolytes viral markers, PT with INR, APTT, and blood grouping is very much important. If any abnormal values, we need to escalate the doctor immediately.
Yeah, I think this is all your protocol,
Yeah.
Jagdish sir. Maybe and
Yes.
all your nurses know
Yes.
about all this. Yeah.
Yes.
Yeah, coordination with the Cath lab team is very important, and the preparation for the patient includes keep the NTM for 6 hours and also prepare the site like through radial or femoral, and insert IV cannula to giving IV fluids and all. And also insert large gauge IV cannula on the left hand and start IV fluids. Monitor hemodynamic stability and ECG changes also we need to monitor. And we need to take the consent from patient, and family education also is very important. And also approach could be radial or femoral as well. Keep the lithotripsy mission as ready and keep all emergency drugs ready, and communicate with the patient and patient attendants when the procedure is going to take.
So, sir, I think these are all the points which your cath lab team and ICU nurses follow. Anything we must have missed or any other concerns you
No,
would
this
like
is a
to
perfect.
address?
No, this is a perfect slide of having an IVL, and I think
Yes.
before doing IVL, this is the main job that somebody has to do, and I think our sisters and lab people at Yashoda are very well trained in this because 50% of job is this, and being at Yashoda, we have a pleasure that our people are very capable, and we leave it to them. Sometimes we see people coming for angiogram and where they put cannula on the right hand.
Yes.
But hardly in these 6 years of my time in Yashoda, I haven't seen a single patient having cannula on the right hand because our people are very well trained in that. Because they know that our cardiologist is doing angiogram in the right hand, so they put a venous cannula on the left. So all these steps are automatically done like an autopilot mode in our ICCU and in our cath lab. So these even though our job, I think these are mainly done by our nursing people, for which I
So
should
heaps of compliments for Yashoda Somajiguda nursing team. Kudos to you guys. Yes.
Yes, sir.
And of course, the mentors are all our doctors. So yes, going forward, sir, how do we perform IVL? Little bit in short, as you have already told. Like if at all, I understand these are the transducer, and it uses a lot of high amount of sonic waves which are sound, and it breaks the calcium.
Yeah.
I think yes.
Yeah, true.
And this
So
process is called lithotripsy, I guess.
lithotripsy. Yeah, true, correct. So this the center one is a balloon. So we take this balloon across the coronary artery. So this is a coronary artery, and this is a calcium chunk within the coronary artery. So I take the balloon between this calcium chunk and then inflate it to low atmospheres, like 4 atmospheres, and initiate the pulse process. So once the pulse process is initiated, we have 3 nodes here. You can see 1, 2, 1, 3. 3 nodes. I think one cursor is on the 3rd node. So,
yes.
So from these nodes, when I activate, a pulse sonic wave will be generated, and this sonic wave is of a frequency that it only breaks calcium. So this sonic wave will easily penetrate soft tissue, and this only breaks calcium. So once this sonic wave breaks the calcium, you can see this nodule will be very much softened and the balloon slowly inflates. So when I'm doing IVL, I can slowly notice as I'm inflating, as I'm delivering the pulses, the balloon slowly inflates. So that is how I get to know that the calcium has debulked. Say in case if the calcium doesn't open as I expect, then I'll do it again. So you can see the difference from the previous slide to before slide. It's the same case. In the previous slide, the balloon is not completely opened, but after the pulse delivery, you can see that the balloon is partially opened and you can see some calcium cracks within the vessel wall. This is the beauty of IVL.
So these are the cracks of the calcium deposits here, the sides?
Yes.
These are the sides. So,
yes, these are the calcium cracks, and you can see that my balloon also has nicely inflated.
Yeah, go back.
You can see that here the balloon is nicely inflated. So here it means there's a very good lesion preparation.
Yeah. And after that, post this, you introduce the stent.
Yes.
Yeah.
So that the stent will easily expand. You imagine
easily accommodate.
Stent is like a small spring, and if I am opening a spring in a cheese, it slowly opens. But if I'm opening a cheese in a hard rock, stent in a hard rock, it doesn't open. So we use the same technique. This is like a carpenter who is trying to drill a hole. within a wall. So here we break the calcium and then we put a stent.
So again, sir, we might, also, try to understand, does like a very heavy amount of calcification is removed. Now, the understanding is, does calcium expel in the urine after
Yeah.
this, procedure? What
Yeah,
now? How?
very nice question. Actually, this is very commonly asked by our patients. Sir, you are breaking the calcium. Can we see the calcium, or where does this calcium go? So,
Yes.
when I'm breaking this calcium is made into finer microparticles, and that is dissolved in the blood, and ultimately it has to go out of urine.
Yes, Anusha.
Yes, immediate post-procedure IVL care is very important, and also educate the patient regarding the sheath removal and everything. Monitor vital signs is very important, and taking ECG. Monitor the vascular access site like radial or femoral, and signs of bleeding and hematoma and pseudoaneurysm we need to monitor. And administer IV fluids or adequately hydrate the patient to prevent contrast-induced nephropathy. And pain management also is very important. And also, after giving painkillers, we need to reassess the patient regarding that pain score and all. Position the patient with caution is very important, because if femoral done means they will be immobilized the leg. And also administer timely medications is very important. In this picture, we can see the post-sheath removal, the timing, immobilization timing. They restrict the radial side for 12 hours and also femoral side for 4 hours. We need to restrict the patient mobilization.
So, sheath removal is very important, sir. I think the point which Anusha has said is to be acknowledged. Yes.
Yeah, I want to add that actually. So if I want to do an IVL procedure, I will divide it into 3 phases. So the first phase is pre-angiogram preparation, where the entire lead is taken by our pre-cath nurses. So the second phase is in the cath lab, where I am also a part, and some of our cath lab people, nurses and technicians are a part.
Technicians.
The third part is in the ICU, where the entire work is taken by our nurses. So in the entire procedure of this IVL, I see that major role is by nurses only. So once the procedure is done, so we comfortably leave the theater and go to our OP or talk to the patients. But these are very important steps that has to be taken care before the patient procedure is being done and after the procedure. So even if I do a wonderful angioplasty and if the patient's hand is swollen, attenders and patient doesn't feel comfortable. So the entire technical, I see like this. If I see a swelling like this, and if a patient or an attender finds a hematoma like this, how much ever wonderful I do a case, it doesn't
Everything goes
get reflected in the overall appreciation. So the post-operative care is most essential and very important. Mainly the local complications like the hematoma, the sheath removal, and secondly, management, post-operative management, giving heparin injections, giving nicorandil infusion, starting on IV fluids to prevent contrast-induced nephropathy. So the before IVL, 4 hours before the procedure, intraoperative procedure, the procedure will take around 1 hour, and 12 hours after the procedure. These are very important phases. So the post-operative phase has to be very meticulously taken care of, and I should congratulate all our people for doing it with great care.
Yes. Go back to previous slide, Anusha. I think a few red flags, like we always expect our nurses to inform to all of you all, or otherwise to the team, that if at all the patient experience hematoma, as you said, bleed or ECG changes or any changes in vitals, so they should inform the team and take the necessary prompt interventions. I think you'll also agree, and your nurses are being trained for the same. Yes.
Yeah. Yes. So whenever after finishing procedure, and I'll talk to the attenders and then go to my OP room. If I get a call from Anusha, then I know that something wrong has happened. So I have to rush.
Yes.
But we hardly get any calls.
Yeah. These are all potential, might or might not.
Yes.
And we have come forward. I think we are coming to the end of the discussion. And what teaching do you provide, Anusha? That is again up to you, your education. Yeah, you can read.
At the time of discharge, we need to educate the patient regarding rest period and also resume work or office, and diet lifestyles modifications, and avoid heavy lifting and bending or strenuous activities, and take medications on time, monitor symptoms, and connect with the doctor whenever needed. And also, if any SOB chest pain means they need to connect with the doctor if any emergency situations, and review as per advice with the necessary blood reports.
Sir, post-procedure, how long you prescribe the patients to be on rest activity? Like, can they just immediately or after 2 to 3 days, they can resume
No,
their office or what?
we actually tell them based upon how the overall status is. Say, for suppose if I'm doing a PTC on a stable case where LV function is normal, the creatinine, hemoglobin, everything is normal. If the patient is fit and fine, then I think we send them to the room on the next post-procedure day and we ask them to do their all daily routines themselves. Say if the patient is having LV dysfunction, if there is some creatinine issues or if too elderly, then we'll ask them to be slow on their work for at least 2 to 3 days, take somebody's help and then rejoin the activity. As an average, we tell them 1 to 2 days rest because we do get patients, lot of patients from northeast parts, and we get lot of international patients. So all these patients will ask us, sir, procedure is done today, can I fly back?
Yes.
And we tell them to just stay rested for a day and they are happily flying since
They can
years.
happily go back and drive and do their
Yes.
activities of daily living. Yes. We have come to the end of the discussion, and as I think everybody, globally, everybody wish to understand that what are the few tips you would like to give for the healthy heart? I think heart and stress, all these mechanisms are, booming nowadays.
Yes,
You know,
yes, yes.
yeah.
Nowadays
So
we are
what is your
seeing
final note? Yeah.
Nowadays, we are seeing a lot of young MIs. Even this week, I had to operate on three patients in 30s. I had to put stents in all people. It's unfortunate to see that a lot of young population are getting MIs. Probably this could mainly be because of our stress levels, and hardly we don't find any time for our own health. We keep running from morning till evening and till night, and even we don't find a good sleep. When I'm sleeping, I'll have ideas. Sorry, what is my job tomorrow? When I'm to what I'm going to do tomorrow. So all these stress doesn't give us a good sleep, and
Mind
I think
doesn't sleep. Brain doesn't
yes,
sleep.
brain doesn't sleep. So I
Brain
think
awakening state. Yes.
stress is most important factor that we
Yes.
need to concentrate on. A good sleep is definitely one because most of us, especially you and we, like people in medical fraternity,
Yes.
we will be not exposed to vitamin D. We are almost always in the closed room. We come to hospital at 8 o'clock and leave from hospital at 8 o'clock, so we don't see any sun. And vitamin D is a very important vitamin that helps to improve vascular health, cardiovascular health. There were several studies which showed that the vasculature in patients with vitamin D is very thick and it is prone to have coronary artery disease. Early aging, all these factors are very closely linked to vitamin D. So vitamin D is very essential factor. In addition to that, lifestyle diseases, I mean obesity, sedentary lifestyle, lack of sleep, smoking, alcohol, all these are taking the greatest chunk of CAD burden. And apart from that, I think I have to plead all people to, we should encourage people to go for regular health checkups, check your blood pressure, check your cholesterol, check your lipids, how bad is your diabetes control, all these things. Say if you get a master health checkup this year, doesn't mean that you are fit next year. So regular health checkups is very important. I'm checking say my sugar now, my cholesterol now. If it's normal today, it doesn't mean that it will be normal forever. Diabetes can occur at any age, cholesterol can occur at any age. So regular health checkups, not just once. We need to have a regular health checkup. In addition to that, we need to concentrate more on active lifestyle. A jog at least 20 to 30 minutes a day, avoid smoking, alcohol, avoid oil foods, eat more green leafy vegetables, fruits, and have a smile on face like our Shanti always.
Yes, we are.
Yes, thank you indeed. That was a very complimented point. And yes, thank you. I think we are going to end the session. And thank you, sir, for your very valuable time. Thank you, Anusha.
Thank you.
And we look
Thank you, Anusha.
forward for more academics. And yes,